Hey guys, welcome back to my page. Thank you so much for tuning in. If this is your first time, where have you been? I've been waiting for you. Where you been? If you love anything relationships, mental wellness, personal development, then this is the page for you. So please go ahead, hit that subscription button so you'll know exactly when I have a new episode out. Now, this week we are going to be talking again a little bit about therapy. So, for the last 2 weeks, we were talking about when's the best time to start therapy, what to look for in a therapist. This week, we're going to be talking about what to expect when you actually start therapy. What's the process? What does it be like? Is it like what they see on TV when they tell you to lay in a couch and you talk about how you feel? Like, is it like that? Sometimes, but not all the time. We're going to get a little deeper into that. We're going to dive deep into getting a better understanding of what happens when we go to therapy, what the process looks like. Being in therapy can range from anywhere from a few weeks to few years. It's really up to you. Again, you are the one that's navigating the ship. It's about what you feel is best for yourself, for your mental wellness. Yeah, it's up to you. But when you first start therapy, like your first day, day one, the first thing that's going to happen when you get in is going to be the intake. So this is where the therapist kind of gets a little bit about you, your background, your family, your childhood, things you've experienced, just to get a foundation of who you are and what it is you're dealing with. During this time, we talk about our goals, like what is it you want to accomplish in therapy? What are some things you want to work through? Which gives the therapist an idea of what they need to do to prepare themselves to work with you. Now, from there, we do what's called an assessment. So, of course, this varies. It depends on the situation. It depends on what you're coming into therapy for. But this is usually where the therapist would assess your mental health. Some therapists, like myself, will give you an anxiety and a depression assessment to take, and we discuss it during your intake. So, I'll be able to see if depression and anxiety is an issue for you. But some therapists, they do that at the second session. You will do the assessment and they'll discuss it during the session so they can get a better benchmark of where you are and what we need to work on in therapy. So then subsequent sessions, we're going to create a treatment plan. For those of you who don't know, the treatment plan, it's usually based off the assessment. This is usually where we as therapists discuss the specific needs that need to be implemented and the needs that needs to be met in order to get to your goal. Okay, so that's usually what happens there. The therapist will be able to use different interventions. They're like strategies that we can use to help you accomplish those goals. Usually, therapy sessions can last anywhere between 45 minutes to 60 minutes. Now, it really depends on a few factors. One, your insurance. Some insurance companies will only pay for 53 minutes. I know it's super petty. I get it. It's petty. It's like, why not just pay for the full hour? But that's insurance companies. Some of them only pay for 45 minutes. Then you have a few that may pay the entire hour. Then you have cash paying clients who want to pay for the entire hour. Or in some cases, I know therapists who offer an hour and a half session or 2 hour session. So it really depends on the therapist. It really depends on what they're offering. It's rare that a client can just come in and say, I want to do 2 hours. Can I do two? Like, it doesn't necessarily work like that, especially if you're using insurance, because your insurance company is probably not going to cover 2 hours. They'll probably cover the first and tell you that you're going to have to pay out of pocket for the next one. So that's something to keep in mind. Some therapists, like myself, give assignments. I give homework. No, I don't give my clients papers to write. We don't do that. But usually I give them activities that they can work on with each other, especially my couples. I like to give them assignments that require them to spend time with each other, to have conversations, to learn how to communicate, to learn how to plan a budget and create a budget. These are some of the things that we work on. Homework should never feel like an additional chore. And as I tell my clients, if the work is overwhelming or if it feels like, oh my gosh, this is just something I cannot handle, be honest and upfront about it. Hey, Melissa, couldn't get the work done this week. I just got caught up with the kids and stuff. And that way we could try to maybe incorporate that assessment or that assignment into the session. So it's always good to be honest about where you are with your work because, again, it's not going to work. Therapy is not going to work if you're not willing to do the work. And sometimes assignments are a part of the work. So there's that. And then there's termination, or as I would like to call graduation, because termination just has like a negative connotation. I like to say graduation. This is the part of the therapy process where you have accomplished your goals or you have all the tools necessary to accomplish your goals and you're ready to end the treatment. It's all about growth at this point. You have the tools, you've met the goals. So I serve no more purpose. As I've been taught, and as I like to repeat, the goal is to work me out of a job. If you want to stay with me for 4 or 5 years, that's cool. That's fine, But the goal should never be to stay with me forever. The goal is to get the tools you need so you can go out there and live your best life. I'm always here for a checkup. If you need to come in maybe once a month, cool. But if I start seeing you and in the beginning I see you every week, my goal, depending on what the situation is, the goal is to eventually graduate you to maybe every 2 weeks, to maybe every month, to maybe every other month, till I don't need to see you again. So that's the goal. The goal is to get you better. I know a lot of people have hangups around therapists because sometimes they feel like therapists are only doing this because they want to make money off of you and trust me, there's good and bad apples everywhere. But at the end, the ultimate goal is to make sure you're good. That's the job. The job is to make sure that you are good and you have the tools and you've met the goals. And my purpose is not to be with you forever. My purpose is to get you on your feet so you can go out there and do what you got to do. So that's some of the stuff that I wanted to share. That's kind of how the process works when you start therapy. I hope this gives you some insight into what to expect and some insight into how it works. I'm always open for conversation. So if you have questions, go ahead, drop them in the comments below and we can have a dialogue about this. If you missed the other videos and you want to catch up, I'm going to have these links somewhere around here. You can go ahead and catch up. But again, thank you guys for tuning into this week's episode, and I look forward to seeing y'all next week. Take care.